And now, his view, an editorial opinion by Bill Martin.
What do you call a person who doesn't tell the truth? Well, liar comes to mind, but people who do not tell the truth don't like that word. They get very worked up at the very hint of that word. Does it take the sting away if we say fib? How about misleading or little white lie? Well, as Shakespeare might have said, a prevaricator by any other name is still a liar. And what are we to do when the fibber is an agency of government, when its employees are scattered throughout the province where they can spread their falsehoods and misinformation? Well, we have such an agency in Nova Scotia. It's called the Nova Scotia Health Authority, the people who supposedly run our healthcare system. It was created by a former Liberal government who gave them that name and also gave them the authority to make decisions for us. They have since dropped the name authority, but they still operate from a position of authority, a stance of, we'll do what we want because we know better than you. Nova Scotia Health continues to, take liberties with the truth. Remember when people were concerned that the new hospital in Pugwash would not provide emergency services? NSH had already converted a number of rural facilities to a system they call urgent care. The idea that if you think you need a doctor, you call the hospital to see if one is on site, and then they give you an appointment. Urgent care, you see, is cheaper and easier to provide than emergency care. That's delivered on demand, not by appointment. The people served by the hospital in Pugwash did not want the cheap version. They wanted their new hospital to have emergency care. It was such a concern, we asked for a public meeting to discuss it. Nova Scotia Health did not want such a meeting, but we insisted. Their first response was to convene a small gathering of invited guests. No, we said, we want a community meeting, a public meeting, where anybody who cares can attend and ask questions of concern. Their second attempt, that was a meeting at the fire hall. It would allow room for about 45 locals, and they could apply for admission. No, we want a public community meeting. They said they could not get a meeting room large enough. Dare I say, fib? They did not try for a room large enough because they did not want anybody asking questions. They would be questioning their authority. With one phone call, I secured the Pugwash High School and offered it to the Premier for a true public meeting. And miraculously, Nova Scotia Health called to say they were moving to the high school and making it a true community public meeting. A number of questions were raised and all were answered, especially the one about whether the new hospital would offer emergency service. And they said, absolutely. They said the new hospital would offer everything you had before and then some. And people were happy. People were grateful. They had their say, received their assurance, and went home talking about the good meeting. But was it true? Did the officials tell the truth? Or did they just say what they knew people wanted to hear them say? They just wanted to keep people quiet. The truth is, in today's hospital, shiny and bright, an outstanding facility with all the emergency tools, but no emergency service. Nova Scotia Health exerted their authority and established an urgent care service. The arrogance of this agency is palpable. They feel they have the authority to do whatever they want, and they've built a huge bureaucracy to protect them. Protect them from us or from any other prying eyes. It used to be that employees would be fired for repeatedly lying to those they serve. Maybe it's time for a serious review. Are they managing healthcare, or are they simply managing the people that they were hired to serve? At least, that's my view. I'm Bill Martin.
You've been listening to His View by Bill Martin. Listen every weekday at noon, 6 p.m., and midnight, right here on Radio from Hope Center.